Hello everyone and welcome to today's lecture, the Integumentary System. For this lecture, we will learn the following things: the functions of skin, the layers of skin and the characteristics of each layer, the factors that affect skin color, the types of common skin lesions, the accessory organs of skin along with their structures and functions, the process of skin healing, including scar production, and the common diseases and disorders of the skin. Functions of the integumentary system. The skin is the largest organ of the body. Its functions include protection. Unbroken skin protects the underlying structures. Body temperature regulation. Body temperature regulation is possible through expansion and constriction of dermal blood vessels. Vitamin D production. In reaction to sunlight, the skin produces a molecule which converts to vitamin D that the body needs for calcium absorption. Sensation. The skin has numerous sensory receptors which allow a person to detect touch, heat, cold, and pain. Excretion. Water and salts leave the body through the skin when a person perspires. Skin structure. Epidermis. The epidermis is the outer layer of the skin consisting of the stratum corneum and stratum basale. Keratin is a tough protein in the stratum corneum, which helps form the impermeability of skin. A keratinocyte is a cell that makes and accumulates keratin. A melanocyte is another type of cell in the epidermis that makes the pigment melanin. Dermis. The dermis is the true skin underneath the epidermis layer. The layer includes epithelial, connective, muscle, and nervous tissues, as well as sweat and oil glands. The hair follicle begins in the dermis and is attached to an erector pili muscle. Collagen, elastin, and nerve fibers are intertwined with many blood vessels in this level. Subcutaneous layer. The subcutaneous of the hypodermis level consists of adipose and loose connective tissue. This layer cushions and insulates the upper two levels from the underlying structures and organs. Skin color. Many words can be found in the dictionaries, which are used to describe skin color. Examples include bronze, dark, dusty, fair, florid, gray, green, jaundiced, olive, pasty, rosy, ruddy, sallow, and white. Melanin is mainly responsible for determining skin and hair color and is present in the skin to varying degrees, depending on how active the melanocytes are and how much a population was exposed to the sun historically. Another factor that determines skin color is the amount of oxygenated blood in the skin's dermis. Well-oxygenated hemoglobin is bright red, while poorly oxygenated hemoglobin is darker red. Skin with a blue hue is called cyanosis. Primary lesions such as macules and vesicles originate from disease or body changes. Types of primary skin lesions include macule. Macule is a circumscribed flat area less than 1 centimeter of discoloration without elevation or depression of surface relative to surrounding skin. Patch. Patch is a circumscribed area of discoloration greater than 1 centimeter, which is neither elevated nor depressed relative to the surrounding skin. Vesicle is a small, superficial, circumscribed elevation of the skin, less than 0.5 centimeters, that contains serous fluid. Pustule is a small, less than 1 centimeter in diameter, circumscribed superficial elevation of the skin that is filled with purulent material. Can also be described as a vessel filled with pus. Papule. Papule is a circumscribed elevated solid lesion less than 1 centimeter. Plaque is a well-circumscribed elevated superficial solid lesion greater than 1 centimeter in diameter. Nodule. Nodule is a palpable solid lesion greater than 1 centimeter in diameter. They are usually found in the dermal or subcutaneous tissue, and the lesion may be above level with, or below the skin surface. Tumor. Tumor is a solid, firm lesion, typically less than 2 centimeters, that can be above, level, or beneath the skin surface, also known as a mass. Wheal. Wheal is a transient, circumscribed, elevated papulus or plaques, often with erythematous borders and pale centers. Bulla is a raised, circumscribed lesion greater than 0.5 centimeters that contains serous fluid. Secondary skin lesions. Secondary lesions are caused by a reaction to external trauma, the healing process, or primary lesions. They include erosion, ulcer, excoriation, fissure, scale, crust, and keloid. Vascular lesions. Vascular lesions are anomalies of blood vessels and include telangiectasias, which are small dilated blood vessels on the skin surface, and ecchymosis, commonly called bruises. Some other vascular lesions include angioma and purpura. Accessory organs: hair follicles. Hair embedded in the skin is called the root, while hair above the surface of the skin is called the shaft. Alopecia or baldness is called when the hair follicles completely die. The erector pili muscle pull on hair follicles when a person is cold or nervous, and goosebumps or goose pimples are seen. This name comes from the appearance of a goose's flesh when the feathers have been plucked. Sudoriferous. The eccrine sudoriferous glands produce the sweat a person experiences when they have been exercising or become too warm. The apocrine glands produce a thicker type of sweat and cause body odor secondary to bacteria. Sebaceous. Sebaceous glands produce sebum or oil to keep hair and skin soft, as well as to prevent bacteria from growing on the skin. Nails. Nails protect the end of fingers and toes. Each nail has a nail bed attaching the nail to the underlying skin. Skin healing. Inflammation. Inflammation of the skin causes redness, swelling, and pain. The area will look red because of nearby blood vessel dilation. The inflammation promotes healing with the additional blood in the area, which causes more nutrients needed for skin repair. Blood clots and scabs. If the skin has been damaged, a blood clot or scab will form, and this is eventually replaced with collagen fibers or scarring. Scars. A scar is an area of fibrous tissue that replaces normal skin after an injury. Scars result from biological process of wound repair in the skin, as well as in other organs and tissues of the body. Thus, scarring is a natural part of the healing process. Skin scars can be replaced with new skin, but if the wound was deep, the scar may remain. Large scars can impede movement of joints. Common diseases and disorders of skin include burns. Burns are a leading cause of accidental death in the United States. Burn percentages over the body are determined by the rule of nines. Burn severity indicates the depth of the injury, with first degree meaning only the top layer, second degree involving both the epidermis and dermis, and third degree being down to the subcutaneous layer. You can treat most first degree and second degree burns at home by running cool water over the area for 20 minutes. Treatment for third-degree burns may include the following: early cleaning and debriding, removing dead skin and tissues from the burned area, intravenous fluids containing electrolytes, intravenous or oral antibiotics if your child develops an infection, and antibiotic ointments or creams. Skin cancer. Skin cancer commonly presents as basal cell located in the stratum basale of the epidermis. Squamous cells are much less common and arise from flat cells of the epidermis. Malignant melanoma is the most uncommon, but is the most aggressive. Once skin cancer is diagnosed, the only acceptable treatment is medical care. Alternative approaches may be useful in cancer prevention and in combating nausea, vomiting, fatigue, and headaches from chemotherapy. Radiation or immunotherapy used to treat advanced skin cancer. Interferon and imiquimod are immunotherapy drugs used to treat skin cancer. Interferon by injection may be used to treat squamous cell carcinoma of the skin. Topical imiquimod therapy, a cream applied to the skin, may be used to treat some basal cell carcinomas. Acne vulgaris, rosacea, and folliculitis. Acne is an inflammatory condition of the skin's follicles and sebaceous glands. At times it may be confused with rosacea, which is a skin disorder that commonly appears as facial redness and acne, or with folliculitis, which is a rash where follicles become red and itchy and often look like pimples. The most common topical prescription medications for acne are retinoids and retinoid-like drugs. These come as creams, gels, and lotions and antibiotics, which work by killing excess skin bacteria and reducing redness. Alopecia. Alopecia results in hair loss or baldness. Alopecia is an autoimmune disease. Autoimmune means that the body's immune system attacks the body. When alopecia develops, the body attacks its own hair follicles. A person's genetic makeup, combined with other factors, triggers this form of hair loss. The most common form of alopecia treatment is the use of corticosteroids, powerful anti-inflammatory drugs that can suppress the immune system. These are most commonly administered through local injections, topical ointment application, or orally. Cellulitis, dermatitis, and eczema. Cellulitis is inflammation of connective tissue caused by bacteria such as staph or strep. Usually cellulitis is presumed to be due to staphylococci or streptococci infection and may be treated with cefalozin or oxacillin. Antimicrobial options in patients who are allergic to penicillin include clindamycin or vancomycin. Dermatitis is a general term for inflammation of the skin and is also called eczema. Mild skin inflammations usually respond to over-the-counter hydrocortisone cream. To reduce inflammation and heal the irritation of most types of dermatitis, the doctor usually recommends a prescription corticosteroid cream and might prescribe an oral antihistamine to relieve severe itching. Herpes simplex and herpes zoster. Herpes simplex type 1 consists of cold sores, while type 2 is genital herpes. Overall, medical treatments of herpes simplex virus infection is centered on specific antiviral treatment. While the same medications are active against herpes simplex virus 1 and herpes simplex virus 2, the location of the lesion and the primary or reactivation of the infection dictate the dosage and frequency of medication. Herpes zoster is commonly known as shingles, which is caused by a latent virus after a person has chickenpox. Antiviral therapy should be considered for acute zoster treatment regimens, regardless of the time of presentation. Impetigo. Impetigo is a bacterial infection. It is a common and highly contagious skin infection that mainly affects infants and children. Impetigo usually appears as red sores on the face, especially around a child's nose and mouth and on hands and feet. The sores burst and develop honey-colored crusts. Mild impetigo can be handled by gently cleansing off the sores, removing crusts from the infected person, and applying the prescription-strength antibiotic ointment. Non-prescription topical antibiotic ointments, such as Neosporin, generally are not effective. Pediculosis and scabies. Pediculosis is known as lice, and scabies is caused by an itch mite that burrows beneath the skin and lays eggs. Primary treatment is topically administered 1% permethrin. Malathion is one alternative for treatment failures. Psoriasis. Psoriasis is an inflammatory skin condition thought to most likely be an inherited autoimmune disorder. Used alone, creams and ointments that you apply to your skin can effectively treat mild to moderate psoriasis. When the disease is more severe, creams are likely to be combined with oral medications or light therapy. Ringworm. Ringworm, not from a worm, is a fungal infection. Ringworm most commonly affects the skin and body, the scalp, the feet, or athlete's foot or the groin. Most ringworm infections are mild and can be treated using a pharmacy antifungal cream. Scalp infections can be treated with antifungal tablets, sometimes combined with antifungal shampoo. Warts. Warts are a harmless viral infection, though may be space-occupying and unattractive. Different treatment options include applying salicylic acid. You can treat warts on places such as hands, feet, or knees by putting salicylic acid on the warts, applying cantharidin, and applying liquid nitrogen. That concludes today's lesson.